Christine. I'm a student at Lincoln Tech, and I'm going to be doing a head-to-toe assessment. Hi, I'm Christine. I'm going to be your nurse today.
Hello.
I'm going to be doing a head-to-toe assessment on you. Is that all right?
Yeah.
Okay. Could you tell me your name and date of birth?
Kelsey LaRose, 12/14/2000.
All right. I'm just going to check your bracelet to confirm. Okay. I'm just going to provide privacy. All right. I'm going to ask you a few questions. Are you in any pain today?
Yes.
Where is the location of the pain?
My leg.
Does anything make it worse or better?
When I walk around, it gets worse, but when I lay down, it's better.
And on a scale of 0 to 10, 10 being the worst pain, can you rate your pain?
It's about a 7.
Okay. And are you short of breath at all?
No.
Do you have any dizziness?
No.
Numbness? Tingling?
No.
Do you have any nausea or vomiting?
No.
Okay. I'm just gonna ask you a few more questions.
Okay.
Can you raise your eyebrows? Puff out your cheeks? Smile? Frown? All right, perfect. And I'm just gonna ask you 4 more questions.
Okay.
Can you tell me where we are right now?
The hospital.
And the year it is?
2022.
The season?
Summer.
And the president?
Joe Biden.
The patient is alert and oriented ×4. And now I would perform my hand hygiene and apply gloves. I'm going to be checking your head and your scalp. So I'm looking for any lumps, bruises, or infestations throughout the patient's hair. And the patient is free of any infestations, bruises, or lumps. So I'm just going to get rid of these gloves, perform hand hygiene, and now I'm going to look, assess her eyes. So the eyes, can you pull down your, the conjunctiva is pink, the sclera is white, the iris is brown, and the pupils measure 3 millimeters. I'm gonna have you follow the tip of the pen light and keeping your head still. All right, and now I'm just gonna perform another assessment of the eyes in a swooping motion. And both pupils constrict bilaterally. The pupils are equal round and reactive to light, and they accommodate, so perla. And now I'm going to look at the nose, so the nose is midline. Could you take one finger, cover your nostril and blow, and then the other? Both nostrils are clear, and I'm just gonna look to see if there's any drainage. And the nose is free of drainage. The lips are pink and moist. Oh, and the nose doesn't have a deviated septum. Can you open your mouth? Do you have all your teeth?
Yes.
The tongue is pink and moist. The mucosa is pink and moist as well. The patient has all of their teeth. I'm now going to look at the patient's ears. So I'm just gonna apply gloves after I perform hand hygiene. I'm gonna palpate the pinea, checking for any bumps or abnormalities. And there's no abnormalities or bumps. I'm gonna check behind the ear for any breakdown. And then I'm just going to check the tympanic membrane for the pearly gray color by pulling the ear up and out. And both ears have the pearly gray color. I'm then going to check to see if there's any lymph nodes. If so, is it okay if I touch you? All right, I'm just going in a circular motion to feel for any lymph nodes. And I'm gonna feel your trachea for to see if it's midline. The trachea is midline. Can you swallow? Perfect. I'm just gonna check your clavicle if there's any skin tenting. And there's no skin tenting present, and so the patient is hydrated. And then I would put the patient at a 45-degree angle, and I'm gonna have you face one way. And then I'd have my pen light on and check for any bulging. And there's no bulging. And I'm just gonna have you turn to the other side at a 45-degree angle. And there's no bulging bilaterally. I'm gonna have you press up against my hand, press your shoulders up. And then can you roll your shoulders and roll your wrists? Can you squeeze my fingers? So the patient has strong range of motion bilaterally in shoulders and upper extremities, as well as her wrists and her hands. Can I see your hands? I'm just gonna check her radial pulses. Both radial pulses are strong and bounding with a regular rhythm. There's no clubbing present in the fingers. I'm just going to check for capillary refill in each finger. And the capillary refill is less than 3 seconds. All right, and I'm just gonna put these on. I'm gonna have you breathe in and out. I'm gonna check the lungs if they're clear and diminished. I'm gonna do 5 anteriorly and 5 posteriorly. Breathe in and out. I'm gonna have you sit up a little bit so I can check the back. And breathe in and out. Okay. Lung sounds are clear. And diminish at the bases, anteriorly and posteriorly. I'm gonna check your heart sounds now. So I'm gonna check the aortic, which is the second intercostal space, the the right second intercostal space sternal border, and then the pulmonic, which is right second intercostal space sternal border, Erb's point, which is right third intercostal space sternal border, and then Erb's point, which is right fourth intercostal space sternal border, and then the mitral, which is fifth intercostal space midclavicular. And I'm just listening for the love dub. And then I would check for her apical pulse for 1 full minute. And after the minute, the rate is regular and the rhythm is normal and the pulse is 66. Okay, now I'm gonna do her GI assessment. Have you had a bowel movement today?
Yes.
And how big was it?
Large.
What color was it?
Brown.
And was it formed?
Yes.
And did you urinate today?
Yes.
How many times?
Like 4 or 5.
Did you have any pain?
No.
What color was it?
Clearish, yellowish.
Okay, and did you have any trouble making it to urinate?
No.
Okay, so this patient is continent. The abdomen is round, non-distended, and I'm just going to listen first in each quadrant for 5 to 30 clicks. Starting in the right lower quadrant. And then the right upper quadrant. And then the left upper quadrant. And then the left lower quadrant. And I did hear 5 clicks in each. And if I didn't hear the 5 clicks, I'd go and listen for 5 minutes in each quadrant. I'm just gonna palpate it if there's any tenderness. And the abdomen is non-tender. Okay, can you raise one leg for me and another?
At the same time?
No, you can, okay. And then I'm just gonna have you put this leg down and you're gonna press down on my hand like a gas pedal. Okay. Patient has strong range of motion in lower extremities and their feet bilaterally. I'm gonna check your pedal pulses, so the dorsalis pedis pulse. So the regular rhythm, and then the pedal posterior tibial. Strong and bounding in both pedal pulses. And then I'm gonna check the patient's if there's any edema. Okay. And there's no edema present. And the other one. And there's no edema present bilaterally. And then I would check if for the capillary refill in each toe. And the capillary refill is less than 3 seconds in each. And then I'm just gonna have you walk 5 steps forward and 5 steps back. And then throughout the assessment, you can sit. Throughout the assessment, I did a skin assessment, and the skin is free of any bruising or abnormalities like cuts and bruising or rash. This concludes the head to toe assessment. I would perform hand hygiene. Can I get you anything?
No, thank you.
All right. Thank you for letting me do your head to toe assessment.
Thank you.
All right, to perform hand hygiene, you're gonna get the water going, rinse your hands, apply soap, scrub in between for 20 seconds or sing happy birthday twice. I'm just gonna count to 20. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, and then you're gonna rinse with your fingertips down so the germs go away from you. And then before you shut off the faucets, you're gonna take some paper towels, pat dry, throw those in the trash. And then you're going to take a clean paper towel and shut the faucets off.